Hi, folks. It's Dr. Christine Sauer, your host of Sparkles for Mental Health. And today I have an amazing guest, Fred Rutman, who died multiple times, but there he is. Hi, Fred. Welcome to the show.
Thank you, Christine. Happy to be here.
So tell us, how come that you died so often? What happened to you?
Well, we can go with the adventure side of it, or we can go a little clinical with the, actually what happened to my body. So maybe I'll just tell the overall story first and save the condition as the cliffhanger at the end. Um, in the summer of 2009, I started passing out rather abnormally and randomly. And I ended up in the hospital a number of times. And the doctors kept trying to prove that I was having a heart attack because I'm a middle-aged, overweight white male. So that's the easy diagnosis. And every time I would pass out, I would hit my head on whatever was in the immediate vicinity that was, harder than my head. And I obtained a whole bunch of concussions in a very short period of time, which makes them even worse. So months went by with them trying to prove I had a heart attack, and they kept testing my blood for enzymes, and I forget what the enzymes are called when you have a heart attack.
Troponin and all that stuff, yeah, but it
And
wasn't.
it wasn't. But and you would think, after 10 times, 15 times, you might say, maybe we should be looking for something else.
What else could it be?
Yeah, but apparently that didn't get considered. So eventually a doctor put a Holter monitor on me. And while I was wearing the Holter, I had a number more incidents. And they finally looked at the results. And the doctor comes running into my room at the hospital. And he's like, holy shit, your heart keeps stopping. You need a pacemaker.
No kidding.
Yeah, I might have suggested that to you guys a week or so ago, and you totally discounted it because, the doctor who suggested it wasn't from Big Shot Toronto. So, anyway, that was my first adventure. They put in a pacemaker. They squeezed me in with a surgeon who I was going to be his last patient before he went on vacation. I'm I'm sure, he wasn't pleased about the extra work. And then I had a couple more incidents while I was waiting, so they bumped me up. And in the book I'm writing about this, I'm sure this guy was thinking about umbrella drinks on the beach, in Jamaica or wherever, while he was doing my surgery, because I think something didn't go right.
I am not surprised. I've participated in many surgeries, and sometimes I said to myself, I'm some glad that that patient is not hearing what they're saying.
Yes, I hear there's a lot of code words that doctors use, to mask what's actually going on, even when they're talking in front of patients. So, um, so nobody checked me for concussions. Nobody checked me for brain trauma of any sort. Not a CT scan, not an MRI. They, essentially released me from the hospital with no sort of recovery plan. It's just like, here you go. You got your pacemaker. Come back in 7 days. We'll make sure it's still running properly. And but there was no roadmap for any sort of recovery, and I was really battered. I had depth perception problems, vision problems. I lost words. I lost an entire language. I could no longer read Hebrew, which I had been doing in some form since I was in kindergarten. Balance, depth perception, all those things were off, and nobody did anything about it. So I just went my own path and figured out how do you heal your brain. Well, you try learning something new and you exercise those and eat better. So that was my roadmap. And that's what I was doing until 2013. So roughly 4 years later. And all this started happening again. And, the doctors couldn't figure out what was happening. So I would collapse, I would hit my head, I would have this weird recovery. And finally, they realized the pacemaker was failing. And one of the leads had cracked. So for the audience, a pacemaker is roughly the size of an old pocket watch. And it's a supercomputer. And they put a couple of leads or wires from the supercomputer to your heart. And it replaces your heartbeat in some function, depending on your condition. So like any electrical cord, they're insulated. And if there's a crack in the insulation, you short circuit. And that's what was happening to me. So,
and sometimes the leads come loose and lose contact. So pacemakers malfunction all the time.
Yep. But it took a number of months to figure this out.
That's amazing. That's unbelievable, really.
Mm-hmm. But wait, it gets better. So I go for the surgery where they're going to put in a new lead. And I'm skipping a whole bunch of details here, but I had severe anxiety. And upon reflection, my anxiety has gotten worse from the post-concussion syndrome and, having been dead and all those things. And then the surgery, almost from the time they started to open me up, and you're awake for this procedure. The first time I wasn't awake. Now they do it while you're awake and they numb you up and everything. I felt that my heart had stopped again. And before it even showed up on the big monitor board with all your vitals and everything, I was just like, oh, fuck, I'm gone. And then all hell broke loose. And I guess they had just moved the pacemaker, I'm theorizing, in a way that made the lead disconnect even further. And that was it. And bedlam. And I have to tell you, when it happens live in the operating room, it's nothing like what you see on TV. It's not like every person who needs to be there is there in 8 seconds, and every piece of equipment and every medication. And, it's just, so the pacing pads, I call them, the
paddles, external paddles. Yeah.
Yeah. So they fired those up, and I think they hit me like every 2/3 of a second or something like that.
And you're still awake.
And yeah, well, they woke me up. They brought me back to life.
I can imagine.
And I don't remember them putting them on me when I went into the operating lab. And so I wasn't really sure what was going on. And I said, I'm back. You can stop pounding on my chest, whenever you feel like it, like this really, really hurts, because you're literally normally you get shocked to death. Now you're getting shocked to life. And somebody says, shut the fuck up. We're trying to save your life. And somebody else says, no, keep talking. We want to know you're okay. So, you've got that really clear messaging.
Yeah, right.
And then they couldn't.
Very reassuring in that moment.
Yeah. And then they couldn't find a temporary pacemaker. So they brought back the module, but nobody brought the lead. So then they had to, and then they didn't anesthetize me because they go up through the femoral artery.
Yeah.
And so they had to cut me open. So there was no numbing agent. There was no antiseptic. So they finally get this temporary pacemaker in, And then I find out I have to be on bed rest, not just bed rest. I cannot move because they don't know if it's inserted well. And they have to wait to see if I have an infection. So it took like 6 or 7 days before they decided they could try this again. Attempt number 2 didn't go so well either. And they couldn't get the new lead through my vein. So eventually they did, but turns out that one didn't last long either, because in 2018, I went through this all over again. So in that surgery, they decided, okay, we're going to do something new. We're just going to put in a total new pacemaker and 2 brand new leads, and we'll go through the right side of your chest. And that surgery was supposed to go swimmingly. I asked the doctor to put me to sleep for this one because I didn't want to go through any of this again. And they did. And for some reason, they couldn't get the atrial lead in place. So they had to figure out on the fly how to keep me alive. And so now I was told I'm one of like 8 people in the world that have 2 pacemakers running concurrently.
Okay, at least a certain safety, you would think.
Yeah.
Or do they interfere?
It's not an exact science. So it took a while for them to get the sensors matched up. So I would have these minor syncopes every so often, only 3, 5, 8 seconds. Certainly not like I was having before, but enough to like make you fall against the wall or something like that. And so that's how I got into my current state of mental health, I guess, which I'm still trying to recover from. So
Tell me about it.
are you saying that as a phrase, or are you telling me to tell you about it?
I really want to know how that affected your mental health, and I suppose it didn't make it better.
No, it made, everything is off, and it's still off. It's if anybody remembers the old style car radios or stereos where you had to a little dial and you'd have to move the needle over to, I'm never quite on the station. You can, so, my nonverbal processing is off. My balance is still a little off. My fine motor controls are still a little off. On the outside, people mostly think I'm pretty good, but only you know yourself. And when things aren't quite up to snuff. I have a lot more social anxiety than I ever did before. I went to a wedding last weekend, and because of COVID, I haven't been in a lot of big crowds or tight spaces and stuff. I found myself having to take frequent breaks. There were too many people, it was too hot, it was too loud, I was uncomfortable, people were bumping into you, and I just had to leave. And I'm a pretty social person. That's never happened to me before. And there's just always this anxiety running in the background. When's the pacemaker going to fail again? And I have to go through this all over again. And right now, about 3 weeks ago, I just found out that the original pacemaker, the battery is about to go. So you just can't lie down on a wireless charger like you can with your phone. So before the end of this year, I guess December 2023, I'm going in for another surgery. So
replace the battery.
Yeah. And they have to replace the whole pacemaker. They don't, technology upgrades and all that. So I think this is going to be my 13th heart procedure of some sort since 2009. And going through the procedure and the recovery and all, I mean, it just grinds on you.
You know, it is really amazing that you had so many episodes where you were unconscious and the brain did not get enough oxygen. That is automatically a hypoxic brain trauma. And
Hmm.
that nobody really looked after how to heal your brain is unfathomable in my books.
Hmm.
And I know you figured out a few strategies for yourself, how to make it better. What did you find that helped to recover some of your brain function at least?
Well, learning things that you felt or I felt were out of my normal learning range. Like
Mm.
I think I'm a pretty smart guy. So I had to go for things that were, outside my comfort zone. And you have to force your brain to create its own neuroplasticity, which is the body's natural response to helping your neural system recover. And that's one of the main ways that they do it. I think next on my list is trying to learn a musical instrument. Um, I also have a precondition. Before all this, I believe I had a stroke when I was born.
Okay.
So I have hemiparesia.
Okay.
So the left side of my body is effectively like a stroke. So it doesn't work so well to start with.
Okay.
So um, the next step is trying to learn something like piano to get more of that cross brain function working.
And I know you also done intermittent fasting because we know that the ketones and the intermittent fasting actually creates brain-derived neurotrophic factor and regenerates neurons, same as high intensity intermittent exercise, if you're allowed to do that. That's the other thing with your heart condition.
Mm-hmm. I now have no restrictions on anything except going like uh, on roller coasters or
Okay.
jumping out of an airplane, because the super fast changes in blood pressure or blood flow might confuse the pacemaker sensors. But other than that, I can do pretty much anything um,
Mhm.
that's excluding things that where I might take a high impact in the chest,
Sure.
you know. So they don't want me doing like MMA fighting or something.
No, I wouldn't recommend that even to healthy people. It is an assault for your brain.
Yes.
And
So
have you ever considered hyperbaric oxygen?
I've been thinking about that. It's just a matter of acquiring the resources to do it. I've heard that's really, really good for you.
Yeah, especially in cases like yourself for hypoxic brain trauma and traumatic brain injury that you had multiples of.
Hmm.
And you had also a lot of anesthesias, which we know is not good for the brain. And being a brain health professional with Dr. Daniel Amen, I don't know if you heard about him in the
Hmm.
States. Change
Yeah.
your brain, change your life. I love his methods. And I know that hyperbaric oxygen can make a big difference for brain function in a case like yours. So I hope that either the system will have it in it to finance that, which they should,
Hmm.
or that otherwise something comes along that allows you to have that method.
They have one at a local hospital that's sort of in the middle of shutting down. Um, and they reserved it for people that have either had the bends and aren't recovering on the schedule they should, or for, I believe, burn victims.
Yeah, that's a typical case. Non-healing wounds. I mean, a non-healing brain is much more important. Sorry to say that, but I think
Mhm.
it should be mandatory for traumatic brain injuries, but it's still not standard of care in
Mhm.
Canada.
I have to tell you, beyond the uh, brain derived neurotropic, whatever the last word is, factor,
Yes, BDN.
um, the the thing that to me has made the biggest difference in my life is the intermittent fasting, because it does so many things, and on the healing side, but it's mostly promoted for weight loss. And even my cardiologist who introduced me to intermittent fasting, it was strictly for weight loss. There was no discussion with any of my doctors about all the other benefits of it, which I know now, and I actually coach intermittent fasting, and it's the list of things that it cures for people is astounding. And I know people say, well, there's no long-term studies that say what you're saying holds up. And I was a coach or a moderator in a 335,000 member intermittent fasting group. So if you have 10 people that report something, that's anecdotal. I buy that. When you have hundreds of thousands of people reporting that it helps with their asthma, it helps with their sleep, it helps get rid of these skin conditions, it helps with inflammation, it helps with this, it helps with that. It's not anecdotal. It might not be a formal study, but the results are there.
There's actually quite good studies about it, and you're probably talking about Jason Fung. He's the Pope of intermittent fasting in Canada. He wrote books about it, and I love everything he does. And it's not just for obesity. And there's good studies that prove all the other benefits. But for some reason, conventional medicine chooses to ignore certain studies that don't make them much money.
Yeah. Well, one of the things that Dr. Fung, I had the opportunity to go to him, but it's too far from where I live. It's an inconvenient trip.
Yeah.
He has so many patients where he's reversed their type 2 diabetes. When I first went in the hospital in 2009, they diagnosed me with type 2 diabetes. In Canadian numbers, my blood sugars were 23.
That's quite a lot.
Yeah, it's like there's a thick syrup running through your body, not blood.
That's a good one, yeah.
And so in American numbers, I think that's something like 420, to give them an idea. And your regular blood sugar.
After 30, you're in a coma, so you were pretty close.
Yeah, often in this medical journey, I've been an overachiever in many things, and that one not so much. So, traditional medicine tells you if you have type 2 diabetes, you're screwed. Your life's going to get worse and worse. It's a chronic condition, and you're going to lose a kidney, you're going to lose a limb, you're going to have not retinopathy. Well, that's one of them.
Yeah, your eyes go, your kidneys go, your blood vessels go, you lose your legs and everything, and you have to stack medication on medication and needle on needle. And what did you find?
I found that once I started intermittent fasting, I had been on insulin 4 times a day, one with each meal and one at bedtime. Within 6 months, I started in May of 2018. And by December of 2018, I was off insulin. My blood sugars totally normalized.
Yeah.
And an interesting thing about being a diabetic is once you're classified as a diabetic, they won't take it off your charts if you're no longer diabetic. So if you've battled cancer and you go into remission, or they call you, they declare you free of cancer, you have no more cancer, you don't have cancer. But if you're diabetic, yeah, you're always diabetic, even if your numbers are perfectly normal. It's almost impossible to get it off your medical chart.
Because officially, type 2 diabetes doesn't go in remission. And to be honest, most people, even if they try it, don't achieve it because it is not that easy. So you had a lot of discipline to actually do the things that you needed to do to achieve it.
Mhm. And intermittent fasting is not as difficult as people think it will be. It's more of a mental battle, and your attitude is your superpower. Um, what really swung intermittent fasting for me was being introduced to oops, this won't show.
That's okay.
Sorry, the book is Fast, Feast, Repeat by Jen Stevens.
Yeah.
And she's the one, it's a New York Times bestseller. So it's usually either her or Dr. Fung in number one in whatever category that they put those books in for the
Yeah.
New York Times bestsellers. And I know her personally now, and I was a moderator for her group. And her methodology for fasting is a little different than most others. And she has something called a clean fast, which doesn't allow you to do the bone broths or the artificial sweeteners or the 50-calorie minimum, stuff like that. So you're either, it's pure water, unflavored, unsweetened, black coffee, black tea. That's it for your fasting period. And it helps get rid of so much inflammation in your body. You won't believe how good you can feel because you don't really understand how bad you're feeling until you get this unbelievable contrast. So
that is so important to hear that from somebody that did it, and not only did it himself, but you heard of many, many others, and studied everything that's on it. And it is so true. And I've done it myself too. I had so much fun doing it. I wrote a little book myself. It's not in any way famous, but I called it the F word diet, just for fun. I'll show you the title page because I'm so proud of the designer. See, you have to look title page.
Very nice.
Isn't that the best fork ever? And it's just a fun little read. It's not a scientific book in any way, but I had fun with the title page. So
well, sometimes, everybody learns differently and picks up information differently. And Jen does a lot of the science in her book, and obviously Jason Fung does a lot of the science.
yes.
But some people just need the stories. They don't need all the, this hormone does that and this hormone does that. So Jen actually has a podcast called Intermittent Fasting Stories, and she interviews people who've just gone on this intermittent fasting journey, and they tell their story.
That's
and
excellent.
There's a little bit of science as needed, but basically it's, people telling their stories. And one of the things we hear most is it gets rid of brain fog because your brain seems to like running better on ketones than it does on carbs. And oddly, when you see the dietitian and you're a type 2 diabetic and they know that sugars are bad for you, what do they tell you to do? Eat like 45 grams of carbs, pump your blood sugar up, and then
5 little meals during the day, keep your sugar up all day.
Yeah, and then take the insulin to take, like, it's just this roller coaster and your body gets so confused.
Insulin for type 2 diabetes is, in my books, contraindicated. It's just not right. It shouldn't be given unless there's no other way and the patients are unwilling to do anything else. But they don't even try sometimes.
Yeah, I guess I should put a disclaimer here. Well, you are a doctor, I am not. So before you do anything like this, talk to people who understand what's going on.
And I mean, not everybody is able to do it, but I love that you tell the story and encourage people. You can reverse type 2 diabetes. And if your doctor tells you it's impossible, he doesn't know.
Well, my cardiologist and my family doctor have both gone to seminars put on by Jason Fung.
Right.
My endocrinologist had never heard of intermittent fasting.
Yeah.
So he said, if you want to do this, I'll send you to Jason Fung.
Right.
But I said, no, I think it's more important that you learn how to do this for your patients. So I'm going to be, your patient zero, and you're going to see how well it works.
Good for you.
And that's what's happened.
Good for you. I love that you do it. Now, you wrote a book. Tell me about the book.
So the book is my ridiculous medical journey that you've heard part of. It's called The Summer I Died 20 Times. And it's scheduled to come out in February or March of 2023. So I say scheduled because, projects sometimes get away from us, but that's the schedule. I actually, just before I came online with you, I sent my final manuscript to the publisher. So hopefully they're going to work their magic with it.
Excellent.
And it's been quite a journey. It's also been a big part of my recovery.
Yeah.
And I didn't set out to write a book. It was just sort of a little bit of journaling that my psychiatrist suggested. And I couldn't remember a lot of the things that eventually I've put in the book because my brain just wasn't ready to release them. And as I kept writing and writing, I'd go through these periods like, wow, I can't believe I came through this. And then on the other side of the coin, there's, wow, what a clusterfuck. Like,
You must have gone through a period of intense anger about the fallacies, about all the mistakes that have been made that were avoidable if they just had switched their brain on first.
Mm-hmm. I don't want to bash the medical system, but in every industry, there's a continuum of, superstars like yourself who can think outside the box and don't have, they're not anchored in their cognitive bias. And there's others at the other end who you wonder, how did you ever get hired? And like, why haven't you been fired? In one of my later journeys, it's not in this book, I was in step down ICU, I guess, after a surgery. My monitor wasn't working. The nurse left me. She went off to find tools because the monitor was also annoying her. Like, she left me.
Okay.
Like, it's just mind-blowing.
Yeah.
But, I've got a really good team now. And some of these things you just, you can't know that a lead is going to crack. Like, usually it's a batch thing. And, there'll be a recall and they'll say, tell your patients this might happen, bring them in, check them out. I wasn't part of any batch lead. It was just something unique to me that this kept screwing up. And, there's just this, I started to mention it, there's this anxiety that just you carry with you. And it sucks up a lot of energy. It really, really does. And so many people have these invisible challenges or disabilities, and you never know what's going on with anybody. And there are some incredibly brave people out there. There's a woman in my neighborhood. I've only met her online. I haven't met her in person, but she's been suicidal for like 15 years. And she just recently underwent psilocybin treatment. So hopefully it's going to do something for her. I don't know a lot about it, but I've read that you have to do multiple sessions for it to be effective. And I think they just gave her a one-off.
Mm.
So,
Well, there's many options actually to treat severe depression. I
mhm,
kind of am a little bit knowledgeable about it because I was myself a patient,
mhm,
and my current husband saved me, thankfully, from getting ECT, and I recovered anyway, my own way, and uh, depression-free, drug-free for years because I
that's
know
amazing.
better. I have other strategies to work it.
Mhm,
But not everybody can do it. And psilocybin is maybe an option for some people.
mhm.
And why not? You need to
Yeah.
try something, whatever
Um,
works for the individual. But like yourself, never gave up. I think that applies for everybody that feels they are not getting the right treatment in the medical treatment system. Do not get up, give up, get a second opinion, try again.
mhm.
You
It's
resurrected yourself 20 times. Come on. If that's not tenacity.
it's I think we're all blessed with a resiliency gene of some degree, or an overcoming adversity degree gene. And some of us are just able to access it a little better. It's not a conscious thing. My parents had very hard life. They had serious medical issues, and they just kept plugging along. And I guess I learned through observing them a little bit about overcoming adversity and resilience. But it's not like they sat us down and said, okay, you're going to have hard times. This is how you be resilient. And I'm just literally, I'm blessed. Whatever your take is on God or universal power or whatever, I've been blessed with a resilience gene and a relatively positive attitude gene that I realize not everybody has, but you can access it. It's like any muscle. If you try to grab it and keep trying, things will improve for you. It's the oh, what's his name? Uh, Man's Search for Meaning,
Viktor Frankl.
Viktor Frankl.
I
And
love it. I heard him in the 80s in Germany,
oh
shortly
wow.
before his death. I was too young to really realize what it is, but I read his book several times and I realized, wow, what a man.
Mm-hmm.
Survived the concentration camp and invented logotherapy as a result of it. Didn't break him.
And if you boil down everything he writes about in that book, it basically comes out to, if you have hope, you can overcome almost anything.
Yeah.
And hope isn't something you have to go buy at the store. It's not subject to inflation. It's not subject to supply chain issues like we're having with everything else. It's just putting it into practice. And there's so many ways that you can fortify yourself with hope or joy or any of those things. Whether you meditate, whether you do tapping, whether you do therapy, whether you do prayer, uh, whether you just hang out with positive people. There are avenues to not do this alone. I've been blessed with a great community. And there's a premise. I don't know if it's Malcolm Gladwell who came up with this, but your basic personality is the sum of the 5 or 7 or 9 people you spend the most time with.
Yeah. Many people said that. I think it is absolutely true.
Mhm.
And if the
And
people that are closest to you are not conducive, well, nowadays we have the internet. We can choose other people to spend more time with.
mhm. And I think choose is the right word. Like, you know, be around good people. In the fasting world, when people were having trouble sticking to their fast or wondering why their fast wasn't working, I would tell them, you have to feed your brain as much as you feed your belly. Like, just keep putting more positive things. I just reordered oh my gosh, uh is it Think and Grow Rich?
Ah, yeah, Napoleon Hill, Think and Grow Rich.
No, this is
Stephen Covey, The 7 Habits of the...
done that. I'll be right back.
Sure. Those are famous books that are helpful for pretty much anybody to read because they're timeless classics.
Yeah. Norman Vincent Peale,
Oh,
Power
yeah,
of Positive Thinking.
right.
And, some people might not like the Christian theme in it, but if you strip that away, the information is still super solid.
Every day in every way, I feel better and better.
Mm-hmm.
Can't say it better than that. I love your attitude, your positive attitude. We need to have a positive, but also realistic attitude.
Mm-hmm.
Because if you just think, oh, everything is great, but it isn't, it's not helpful. But it can still get better and better. And I think that's what really is meant by positive thinking.
Yeah. And, there's some realities that just can't happen for people. I am never going to be an Olympic sprinter as much as I would like to. I'm never going to dunk a basketball. I'm never going to be able to play in the NHL, which was, my childhood dream. But you find other things to aspire to.
Absolutely.
And, even if it's, watching 5 minutes of something inspirational on YouTube, it's there for the taking.
There's lots of very inspirational and helpful material out there. Most of it is available for free if you look for it, or for very low cost. There's excellent books, classics, there's excellent books, and it's much more helpful for most people to partake on those activities than to mindlessly watch TV news all day. Let's put an extreme case on it, which some people do, and it makes you unhappy. The more you watch, the worse you feel.
To layer on to the hyperbaric methodologies that you said, I was just talking the other week with my therapist, and we were talking about yoga. And yoga does amazing things for people because it makes your body bend and contort and exert, and it does amazing things for people. Add on to that, it makes you do a lot of breath work, which I'm just learning about. And breath work, just elevates your body.
Absolutely.
And if you can
so many people can't breathe properly. They don't breathe in their belly. They breathe. That's anxiety breathing. Yeah. And there's amazing breathing techniques in yoga. I myself do some yoga, but I do mostly Tai Chi, but that died down in Nova Scotia, sadly. So I probably go more into yoga now myself because it's just readily available. But I love those techniques. Mindful meditation, movement. It's for all parts of body, mind, and soul. Big fan. Well, Fred, I thank you so very much for being on the show. We have to wrap it down. I could talk to you and with you forever because it is a fascinating story. You have learned so many things that you can share with others and give them hope. Even if something goes wrong, you can recover from it and go on to live a good life, to help others with your story, to even write a book. Come on. Awesome. Thank you so much, Fred.
My pleasure. Thank you so much for having me.